I'm Ariel Kramer. Thank you all so much for joining. So we are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center of Healthcare Innovation. We're in our 6th year of our awards program dedicated to identifying the most transformative, disruptive, and innovative companies shaping the future of healthcare. This year, we had over 1,500 applicants and 300 were named quarterfinalists, and we've narrowed it down to 150 exceptional finalists. And we're so proud to present today our 4 best in class and 9 rising star finalists in our category here. Thank you all so much for joining. And Dr. Klasko, I will let you take it away.
As a 70-year-old whose chronological age and emotional maturity do not necessarily match up, I am really excited about this category. It's a relatively new category. And I think what's interesting about this is that in many ways, seniors are just being discovered in the digital health transformation world. I gave the senior health and technology talk for South by a few years ago, and it was just interesting because we looked at the statistics of the $4 billion or so that's going to be spent on seniors that are doing everything from buying Apple Watches to Apple Vision Pros, but so little of digital health transformation was being spent in this area. I think that's changing, and your great companies are a great example of that. And even how we define longevity is changing. It's obviously not just years, it's what you're doing with those years. And each one of you really represents a very unique aspect of how we're doing this. So I'm really excited about this conversation, and I'm really excited about turning it over for a few minutes to our great category champion, Andy Miller.
Thanks, Stephen. And thanks to the Digital Health Foundation for doing this. I agree with you. I think longevity is a very interesting category that has not gotten the love and attention it rightly deserves. And so we're really excited to be here and look at these great companies. You know, at the Age Tech Collaborative, we're constantly trying to find the best companies out there. We often talk about we sit at the nexus of longevity and technology. So I'm again really excited to be here. Can't wait to hear from each one of these companies, and congratulations to all the finalists.
So, and then we'll jump right into your questions. Thank you.
Okay, well, let's start up by looking into the future. So I'm going to ask each of you, as I mentioned, I'm 70, and let's say because of your company 5 years from now, what's going to change in my world or somebody like me? What's going to be the one thing because of what you're doing that wouldn't have been true back in 2024 if we're talking about 2029? John, let's start with you, Linus.
Yeah, sure. Thank you for having us, and this is an honor to be here. What Linus is really bringing with our core cognitive evaluation for 5 years from now is your ability to prevent dementia. So just like detecting cancer early or finding, hypertension before your heart attack, the ability to have a digital tool that measures your cognition so sensitively that you know that you have mild cognitive impairment and can begin to act against that knowledge and prevent dementia. So 90% of people with mild cognitive impairment are currently undiagnosed. And at that stage, 70% of people can either improve their thinking or stabilize their thinking without medication.
Oh yeah, that's obviously a huge issue. Paulo, what about the CERN? 5 years.
Yeah, so I think, as a clinician that's been in practice, I think, there's been some novel developments throughout, every sort of phase of the evolution of medical science that really have disrupted. I mean, if you look back to sort of the adoption of the stethoscope, when it came out, clinicians were sort of reluctant to participate in using it. There was a pattern of adoption that was prolonged. But we ultimately are sort of facing a crisis where new technologies need to be evolved, and we have to adopt tools to be the next stethoscope to, in the future of how we practice medicine. We're having dwindling numbers of providers. We're having an increasingly, aging population. There's this growing need to become personalized in how care is delivered. There's this growing need to sort of manage the social divide. And so what we're doing is we're actually building predictive models that identify utilization patterns that help in sort of costing and right-sizing the cost of healthcare delivery for vulnerable populations like the older age population. But we're also kind of addressing some of the clinical decline as well, identifying issues like falls and frailty and things that are big drivers of care outcomes that impact not only patients, but the caregivers that care for them. the providers that are increasingly becoming disengaged and need to have something to kind of connect with. And so I feel like the tool in the medical black bag of the future is going to be solutions like the ones that you see here. And, Discern is really, seeking to be that, right? The next stethoscope in the medical black bag of clinicians.
Thank you. Thank you, Paul. Scott, what about Care Predict?
Yeah, thank you for having us on here. I think for what you're going to see 5 years from now is really us focusing on a shift from reactive to proactive care. So really, how do we predict that there is a change in your behavior prior to this leading to a major medical event? So we want to use continuous and autonomous monitoring without invasive tools like cameras. So really being able to use a wearable to be able to follow patterns, create your own kind of norm, your baseline, and when your behaviors fall outside of that, whether it is your number of bathroom visits, whether it is your sleep patterns, your activity patterns, when they fall out of your baseline, we want to be able to flag somebody to say there is a change here. And let's look at this change because it's a minor change right now before it becomes a major medical event. So much of money right now is being spent kind of on that kind of after the event has happened, but how do we prevent that event from happening? We're going to use, like I said, continuous and autonomous monitoring to make sure that those things are caught as early as possible.
Great. Rob, how about Molecular U?
Thanks, Steve, and thank you, everybody. And this is a really incredible group to be included in. Our technology is really going to change the way we approach health, and similar to what Scott was mentioning, and longitudinal monitoring, but on a blood basis. And so what we perform is a multi-omic analysis that digs deep and provides insights into conditions that are arising before they become symptomatic. Recently, we identified a pancreatic cancer patient at the earliest possible stages in stage 1. We can do this with Alzheimer's disease. In fact, we do it across 26 major conditions. And so I think in your case, Steve, what we'll do is we'll test you at least once a year. If we see something, we'll test you, maybe every 6 months to refine it a bit and make sure that that disease that might be emerging doesn't emerge. We make those changes in your lifestyle so that you avoid that and avoid taking any medications. If you are on medications, we can support you there. We can help you make sure that comorbidities don't arise, working with your practitioner, make it easy and simple for them to understand as well. So I think the future is bright as long as we move to a more proactive rather than a reactive, expensive healthcare.
Great. Looking forward to that future. Thank you. Ron, how about Tuned?
Hi, so we are at Tuned actually focusing on getting your hearing health at a much better level. So if you mentioned your age before, statistically speaking, people over the age of 70 are about 40 to 50% likely to suffer from some kind of a hearing loss. And the fact that is, if we look at the US, only 14% of the people who suffer from hearing loss actually go and get hearing aids. And this is exactly where Tune come in. So we built a software platform that makes that entire journey of getting your hearing aid fitted as easy as possible with the new guidelines of the self-fitting over-the-counter hearing aids by the FDA that came out about 2 years ago. And just about 2 weeks ago, we saw Apple also entering that field. This is exactly what we're trying to change. So more people will have better accessibility for hearing health and will go and get their hearing aids at a much lower price and a much faster journey.
Thanks. As a DJ, I sort of will really appreciate and need that. So thank you. Seth, Kemtai.
Sure thing. Thank you, Dr. Klesko, and hi, everybody. Just to give a quick background on Kemtai, so we are in the musculoskeletal space mostly. We're a computer vision platform that gives real-time feedback and corrective guidance for physical therapy. And when I think about what the impact will be over the years, well, I think it's going to be in the MSK space. Well, it's the biggest driver of costs in the US healthcare system, more than cancer, more than diabetes. It's known that physical therapy and rehab can very effectively improve outcomes and reduce costs, but it's not actually happening in practice. Those costs are continuing to rise, and that disconnect is where Kemtai is trying to play by making physical therapy more accessible and more scalable. We are trying to make sure that the benefits that we know physical therapy can drive are actually realized. And in terms of the longevity category and why that's relevant, well, physical therapy is particularly inaccessible for older adults, given transportation challenges, wait times, etc. And so by making all of that more accessible for older adults and the broader population, we hope that the benefits of physical therapy that we know exist actually come to fruition rather than the rising costs and poor outcomes that we continue to see today in that space.
And my guess is that pickleball will be one of your great drivers, just having talked to some of the orthopedic surgeons in my system. Taku, Isan.
Hey, thank you for having me, Stephen, and thanks for the opportunity. So at Toku, we are analyzing retinal images that are captured from the back of your eye during a normal eye exam to calculate your biological age. And this is by looking at indications of diabetes, hypertension, hyperglycemia, any kidney damage that eventually shows up in the eye. To your point, Stephen, I think Toku's mission is to essentially increase awareness about someone's aging and biological age. Many people are not aware of their aging process. I want to say majority of people are not, obviously excluding the people on this call. Over 100 million Americans have an eye exam per year. Majority of us on this call are wearing glasses or contact lenses. Every single of you will know your biological age in a year or two when you're having an eye exam, because the optometrist is capturing that image anyway as part of an eye exam, and our technology will tell you what your biological age is. It's all about creating awareness. As soon as people understand that they are aging faster or hopefully slower than what they should, then they can follow with immediate actions.
At MyCare, we built a conversational AI to support aging in place. So if you say 5 years from now, we'll be looking at trying to convince your children not to put you in a care home, and instead using our conversational AI, Monica, we will support you to navigate through the aging process. So you can benefit from the information that is relevant to you for any chronic conditions that you might be suffering from, be it diabetes and hopefully not dementia. And what we built is able to interact with you, not only monitor you, but give you utility, be a companion, be a friend that you can trust, and guide you through the process of dissecting all the information that you get from the LLMs, but personalize those information for you to make it easy for you to follow, so you can age in place, happy and healthy.
That sounds like a great mission. Thank you. Mary?
Great. Thank you, Stephen. Lovely to be with everyone. So Vori Health, we are a virtual first nationwide musculoskeletal medical practice, and we actually partner with Chemtai. So what would we do that would make your life different in 5 years? We would keep you healthy, active from the musculoskeletal standpoint, and which ties into all these other conditions. If we want to help fight dementia, if we want better vision, we have to stay physically active. And so we know that means addressing all the aches and pains and low back pain that everyone gets. So we are personalized, we're convenient because we're virtual, we're physician-led, because we know that while physical therapy is essential as part of an MSK plan, it in and of itself is often not sufficient. And so we're going to help you stay active, which is going to increase your longevity and keep your brain healthier and your vision better. And we're going to lower your risk of inappropriate surgery, which I'm sad to say is still, widespread here in the USA, because our focus is to try and get you better without surgery. If you need an operation, we're going to get you to a good surgeon.
Yeah, somebody who ran lots of marathons in my 20s, 30s, and 40s, and they said you should stretch, and I said, well, why? And so, well, someday when you're 60 or 65 or 70, you'll appreciate it, and you don't think that that's going to happen. And so, yes, I think that what you're talking about is huge.
We're here for you. We're here for you.
Thank you, Asaf.
Thank you, Dr. Klasko. It's great to be here. My name is Asaf. I'm from Intuition Robotics, the developer of ELIQ, the first AI companion robot for older adults that helps them to age independently in their own homes. Thousands of older adults in the US already kind of live with LEQ thanks to state government funding and healthcare funding. Think about an AI companion that can be with you 24/7. As an older adult, help them, first of all, and encourage them to stay healthier, happier, and more independent. The interest of, all the parties involved is that as older adults, we will continue to live in our own homes and have the ability to kind of create a social kind of engagement with our family members, other caregivers, and the different services that can allow us to stay more independent and healthier. We definitely see the solution kind of going forward outside of the shell of the robot that we have built to other devices around our life, also supporting on-the-go kind of a mission for older adults to kind of carry this kind of a companion with them through wearables and other devices. And the idea that, if today we manage to show efficacy of like 90% improvement in social engagement and loneliness reduction, and 95% kind of improvement in general wellness and health improvement, how this kind of numbers are even growing in terms of the older adults that can actually have this kind of entity as part of their lives.
Great, thank you. Ryan? I think you're on mute.
Sorry, I didn't know if it was doing it automatically. Thanks for having us. At LB, we are on a mission to make caregiving easier. And if you look out 5 years, statistically speaking, we know with dementia and Alzheimer's growing at a rate of approximately 320%, and published statistics showing the opposite trend line of that growth being a shortage of professional caregivers in the ranks of hundreds of thousands. With the aging population that we have, the change that you'll see is more folks in their 30s and 40s and early 50s taking care of loved ones in home of dementia and Alzheimer's. And so what we've done is, we have set out to make that easier for folks by allowing them to take back and recover time and resources. With LB, we're providing a digital tool that will help with behavioral escalations. It will help coordinate care and delegate other tasks and responsibilities. And finally, it'll help plan the ideal day for your care recipient. And so our goal is, this is a generational shift. It's a moment in time where there's an existing crisis that is about to be amplified and pressed down on homes throughout the nation and the world, in fact. And our goal is to leverage technology to put solutions that would otherwise only be available historically in a clinical setting into the hands of home caregivers caring for loved ones and care recipients at home.
Yeah, fantastic. Thank you. Vinay?
So I think in 5 years, because of Manifold, you'll have new therapies, new diagnostics, and new preventive approaches. Manifold provides a software platform for clinical research, really bringing together all of the data that we know is inside institutions, publicly available, but is really not being put together to build a complete picture of patients and really enable all kinds of researchers to make progress a lot faster. So we think of, our enabling capability as making clinical research 10 times faster at 1/10 of the cost. And, we believe that will help bring all of these amazing capabilities out to our future selves.
Great. Well, thanks. I want to ask a sort of a three-part question. I'll give you a little bit more time for each one of these, but they're related. So the first is, it seems to me that unintended consequences are not unintended if you know they're going to happen, right? If we knew that Mark Zuckerberg hadn't created Facebook just so I could see my unbelievably cute grandkids, but could affect elections and spew hate, we might have put some guardrails in. The second piece that's hit me is, I guess it falls under it's hard to get somebody to do something when their salary depends upon them not doing it. And a lot of technologies in healthcare is the case. And then the third thing is that a lot of these new technologies and digital transformation have just furthered the gaps that made the wealthy healthier. So my three-part question is, what are you doing within your very innovative spaces to put trust in, and trust being as important to technology? Who's going to pay for what you're doing, and where do those benefits accrue? And how can you make sure that the new technologies aren't just helping, Steve Klasko in Miami, but helping, Mrs. Jones in North Philadelphia that might not have access to or a Ring and Apple Watch and the technologies that you're doing? So why don't I start with Ron on that question, Tuned?
Yeah, so that's a great question, and that's a core part of our goal in the next few years. The entire idea behind Tune is to be a software solution for hearing aid manufacturers, whether they are top tier hearing aid manufacturers or more basic one, so they can use the Tune software that's already commercially available and proven to be very successful with our target audience, which are the elderly, of course, to really make the use of hearing aids much more simpler. And the entire idea behind Tune is, let's take the human part out of it, the service part, which costs the most in hearing aid fitting, and transform it into a smart AI solution that we call the AI audiologist. And what we've shown to the FDA since Tune received FDA clearance about a year ago is that we can get to the same clinical outcome compared to a professional fitting. So with our technology, what we currently are working on now, also with third world countries such as China and India, is that you can take the Tune software and put it on any piece of hardware, any piece of hearing aids, or now with the transforming of the AirPods into hearing aid, also, you can just use the software and make those hearing aids much more accessible for anyone. So what we see is that the cost of hearing aids with the Tune software has reduced by 80 or 90%. So that's a big difference. And it's good also for the US market, in which hearing aids cost a fortune, but it's also a brilliant solution for countries that could not afford thousands of dollars for hearing aids, or the hearing aids are being reimbursed by the government. With our solution, it just makes it much more easy and much more cheaper.
Right. So Mary, trust, finance, who pays, who accrues, and what does this do for equity?
Yeah, those are great questions. So one of the, in terms of who pays, we favor value-based contracts and contracts in which the patient is not having to pay out-of-pocket expenses. And in our model, where the patient's surrounded by a care team led by a specialty physician, and they have a physical therapist and a health coach, and will pull in a registered dietitian if needed. So none of those visits are going to result in an out-of-pocket expense for the patient, ideally, because then they engage, and then we can get them on their care journey and making improvements quickly. So the accessibility part of virtual is so important, because when we think about seniors and those with mobility issues and difficulty with transportation, which was already mentioned by Seth, the ability to access virtual care, and in particular virtual specialists, really helps drive health equity. So most Americans have access to the internet, not all, but most. And so again, making your program, we're available. You can use this on your phone, your desktop, your laptop, wherever. That's important for equity, particularly for people in underserved communities, those in rural America where they don't have good access to specialists. And trust, how do you build trust? Healthcare still remains a patient and caregiver interaction. And I will share that I think our interactions with our patients in the virtual environment are actually better than in person, where most of the time the clinician is being distracted by the EMR and the computer. You can't do that in the virtual space. I'm with you, right? One-on-one in the virtual space. So I really think that helps drive a high level of trust. And again, you have to have compassion and empathy, and really keep the patient at the center of the care plan and what you're doing. So yeah,
That's
all
key.
the things we're working on.
Thank you. Well, Seth, this is like a debate. Since she mentioned you, we'll go to you next.
No problem. So I'll start with the equity piece. We have, in the design of our product and offering, been very deliberate in keeping equity in mind from both a scalability and accessibility perspective. So Kemtai runs on any device with a camera. So a phone, a tablet, a laptop, these are devices that most people have. And it allows us to reach those populations that traditionally have been unable to attain, strong quality care in the rehab space. And we're seeing, that this allows those populations to have access to it. And then in terms of who's paying for it, well, a couple different segments of types of organizations that are paying for it. One is providers, right? So we're helping to make their care more efficient. They can treat more patients with the same level of clinical staff, and level of clinical staff is obviously a big issue today with shortages. Then you also have digital platforms that are serving the market with their own specific solutions, and they need a way of bringing it to their populations around the country or around the world. And then lastly, payers, right? These are organizations that are shouldering the vast majority of the huge musculoskeletal care costs in the United States and in other countries as well. And so they're looking for opportunities to reduce those costs and improve outcomes for their patients as well.
Great. Asaf?
Yeah, that's a great question. So in terms of kind of who subsidize or how we bring LEQ to the market. So today, 80% of our install base is kind of fully subsidized or partially subsidized by state government, health plans, and providers who find those that are mostly in need based on their socioeconomic level or based on their kind of a number of chronic diseases. And they kind of pay for the subscription for the individuals themselves. This about 20% kind of is under private pay. And the idea here is first of all, to allow the older adult to get access to the service, as a new category is always a challenge, to kind of show the efficacy, but mainly kind of let them experience the new technology and build this trust with them. On the trust level, one of the things that we had in mind is that no matter who is kind of paying for the device, in order to kind of put the older adults in the center, we always think about them first. So from privacy perspective, even when we share their data with their providers or with the health plans, it will be always by kind of getting the consent and the permission from them, and by notifying them like step by step when this is done, so they feel like they are fully under control. And at the end of the day, the value of LEQ is through this trust, because when they trust their companion, they will collaborate with their companion, they will kind of rely on the companion in their day-to-day, and this will allow us to kind of get a better efficacy. The idea of leveraging this AI to also get access to other services that are provided either by the health plans or by the state governments also kind of make it more kind of beneficial for both the older adults and the kind of an entity that subsidizes it for them.
Yeah, that concept of active consent, I think, is really, really important. Ehsan.
Yeah, thanks for the opportunity. So Toku was built on the idea of equity. So, we are working in the eye care industry, optometry and ophthalmologist. I'm not a clinician. I'm a bioengineer, but all of my life has been in the eye care industry. And the main reason for that was my father lost his eyesight when he was only 4 years old. And the only reason my father went blind at that age was my grandfather was too poor. So nobody looked, he went blind. So I started my journey to do something about this. And, when I was 18, I thought one more doctor, not going to make a huge difference, but technology will do that. That's like 30 years ago now. It took me 30 years to get here, but Toku is built on that idea that they helping people that otherwise cannot get help. So now optometry is by far, to me at least, the most accessible part of any medical healthcare system. Main reason is that it's almost at every single shopping mall, at every high street, you have an optometrist. And majority of people interact with their optometrist more often than they do with their primary care provider. As a matter of fact, Toku has 2 FDA breakthrough designations for different products. And as part of every single of those, we had to prove to the FDA that our product is not just novel, but it provides access to people that otherwise they wouldn't have. How did we generate that data? We essentially went to a whole lot of optometry clinics, gather the information about the people that they receive and sort of categorize them by level of insurance that they have. And majority of people that go to the optometrist, they don't have insurance, but they need to see. That's why they are there. And that's why they need a pair of glasses. So Toku is built on the idea of equity. How do we get paid? We sell our product as part of an eye exam. So if we can afford an eye exam, we are already included. And then the optometrists get paid by the vision insurance. Like vision insurance is a bit of a unique thing. It's not necessarily insurance, it's a bit of a prepaid plan. Some people use HSA, FSA account. We are very low cost, keeping it as affordable as possible to the people who need it. How do you generate trust? I mean, it was mentioned that, through getting a product through the FDA, which our products are. So that is a level of trust. And then you publish and, do clinical trials, studies and all that, you generate trust among clinicians. At the end of the day, it's all about people using your product and see the value. That's how you generate trust. If I told you 10 years ago that there is a car outside waiting for you with a stranger in it, do you want to get in it? Your answer would have been no. All of us do that today because it's Uber, right? So it's just a matter of people using it, see the value, and then trusting it moving forward. That's all there is to it. So I'm hoping that soon most Americans will have access to the process of aging and more other products that we're doing just because they can afford an eye exam.
Thank you. Appreciate it. Ryan?
Well, I'm gonna take the question in a couple parts because it's a three-part question. So from the equity perspective, I'm gonna use the word accessible, right? With LB, the goal is to create accessibility. And I'll start with just where the product will live. It being a mobile application, 96% of Americans own a smartphone or a tablet. And so by putting the product on a mobile phone or a smartphone or a tablet, we're able to put it in the hands of just about every American, arguably, statistically speaking. And in the self-pay model on a monthly basis, the product will be priced, right around comparable to maybe a couple of cups of coffee on a monthly basis. So, barring any income exclusions or, dire circumstances, one could arguably afford the product if it's in a self-pay format. Now, on the health plan side, on a fully insured format, this app benefits, being a solution for the caregiver, but the ultimate beneficiary being both the caregiver and the care recipient. From a health plan's perspective, we've already shown a 20% reduction in psychotropic medications in senior and memory care. We've already shown an 87% effectiveness rate with our behavioral interventions for care escalations. We've also shown a less than 2% escalation in care to emergency rooms. These are metrics that health plans are looking to create documented decline in, and the app is doing so. And when we move over now to, an employer or a self-insured format, 18.5% of caregivers or employers will report a loss in productivity for somebody who is not only their full-time employee, but also giving care to somebody at home. And that's a staggering number to offset for employers. And so coming all the way back now full circle to accessibility and it being a mobile app and some of the features of the product, we're talking about no cultural barriers and we're talking about no language barriers. The app is available in 136 different dialects. And frankly, because of situations where you may have an in-home caregiver who speaks a different language or a dialect than the care recipient, we can help create or reduce or mitigate the boundary that can be created there. And culturally speaking, we're working through our technology to also mitigate any cultural barriers with different dialects. So I hope that answers the question of accessibility.
Thank you. Kelvin?
Oh, thank you. So for me, three-part question, it's about accessibility, affordability, and ease of use. And those three were core for us by design right from the word go. And before we even developed any hardware or software, we spent years engaging with the key stakeholders, the caregiver and the care recipients, to make sure that what we build is aligned with the older adult, for instance. So we didn't go down the route of a mobile phone because when we looked at rural Tennessee, the majority of our users didn't even have internet at home. So how do we give health contents to them when they don't even have internet? And that's why we came up with a standalone product that comes with the internet, and also doesn't require those that are potentially visually impaired to have to use a mobile phone. So we do everything through voice and through our companion, Monica. When it comes to the building trust, think before you start to remind them to take their medication, remind them to hydrate, remind them to sleep on time, you have to spend time to get to know them. And that's something that we spend a lot of time to really understand. How do we build rapport? How do we get our AI to ask them simple, basic questions like, can you tell me about your grandchildren? Can you tell me some of your best memories as a teenager? And then you use this to create contents to drive engagement between the bot and the user. Now, when it comes to who pays for it, 100% of our licenses are state paid today. And but to be able to achieve this, you need to be able to show the, let's say, 3-to-1 ROI over the investment. The provider should be able to generate those health improvement. And for this to happen, you need to be able to personalize the care. Then only you can actually deliver this at no cost to the patient or the user.
Thank you. Scott, how about Care Predict? A three-part question.
Yeah, so as a company that's focused on older adults, we see that 50 to 60% of total healthcare is spent on individuals over 65 years old. And most of that money is kind of funneled into clinical care. And so what we're really trying to do is to shift that to where we really are focusing on that reactive, not that focusing on the proactive, not that reactive model. So we're in conversations with Medicare Advantage and value-based care companies to ensure that our benefits are shared equitably, but also our primary customer is going to be those senior living communities or in-home health companies. And so whether that's a for-profit or not for-profit, what we are doing is we are going to create the ability to be a force multiplier when it comes to caregivers. And so as Ryan mentioned earlier, there is a very big shortage of caregivers, and that is only going to get bigger as our baby boomers continue to age. And so I think by 2030, all baby boomers will be above the age of 65. So we really need to have these force multipliers. And so what Care Predict is able to do is we are able to really help a community or in-home or a caregiver understand when there's a change in that person's behaviors, which is an indication of some other health issue. And so by doing that, we're able to have our caregivers work more efficiently, as well as our nurses really be able to say, who do I need to talk to or work with today because there is a change in condition that may be leading to something bigger. So through Care Predict, we've been able to reduce hospitalizations by 39%, reduce falls by 69%, and increase length of stay in senior living communities by 67%. All while doing this, we're improving our staff response time to the needs of our residents by 37%. So what we're really trying to do is invest this money early as a senior living company or in-home health, get more out of the team that you already have in place, which is going to be harder and harder to find as we have a shortage of caregivers. And so that's what our product is going to do. The trust comes when a caregivers see that the predictive analytics that we provide with them match up with the qualitative metrics that they're seeing. So I'm noticing there's a change with this individual. However, also the AI-powered Care Predict is also noticing those two things aligned. Now I've built trust in this product. And so the next time when maybe I didn't see those changes, but the predictive analytics of Care Predict tell you there's a change, now I have that trust because in the past, those two kind of metrics have aligned.
Great. John.
Yeah, this is a great question. So equity, trust, and access are pillars at Linus. If you're going to have a AI generated score that aids doctors in diagnosing early cognitive impairment or dementia. It's really important that you come into this trying to eliminate the bias of the current system. The current paper and pencil tests do really poorly in minorities, and we knew that coming in. So we've studied it longitudinally, not only in the Framingham Heart Study, but also the Rush minority cohort. Our most recent clinical trial actually showed that we had no ethnic or racial disparity in our score. We've deployed the technology in community clinics in Jamaica, as well as in public health clinics in Mexico City to really push and ensure that we're not bringing bias into our testing. With regard to the trust, there is the trust from the clinical validity. So we have pushed through major clinical trials. We recently closed a 1,000-person clinical trial that had full neurocognitive testing, PET scanning, and full diagnosis, and compared ourselves to those absolute gold standards so that somebody can actually really take and step away with a good clinical validity and trust in that. And then from a medical device perspective, you really need to build so that it will be covered by insurance. So we have purpose built to meet all of the Medicare, Medicaid requirements for reimbursement. So this can be done at no to little cost to patients because their physicians and their clinics are reimbursed for administering and interpreting the test and providing them with education and the care plan. So over the last decade, it has been a huge focus to eliminate the bias of the current paper and pencil tests, get the clinicians reimbursed so that they're able to execute against this and do so with enough clinical validity that we can get adoption.
Great. Rob.
Thanks, Steve. And this is a question that all 3 points are really something we think about deeply. The biggest thing that we've been able to do is concentrate our 280 metabolites and proteins into a platform that makes it super affordable to run. If you were to do that in any other platform, you would be spending thousands of dollars to get the kind of insights we were able to provide. And as we get more scale, this is going to be becoming more and more affordable. The interesting part about the biomarkers that we're analyzing is that a number of them are already reimbursable. And so we have CPT codes that we can apply and already get reimbursement for this. But we do expect that not all of this will be covered. So there will be some demonstration that this has a return on an investment from payers over time. The equity is something that is just so dear to everything we do. When we think about personalized health, how can you get more personal than an N of one? We do analysis on each individual as an N of one, compare that to all the world's literature through AI tools, and really understand where that individual is in their health journey and give them very precise, specific action plans that apply to them. This is empowering. So every individual is now not only knowing what they need to do, but they can follow this themselves in their day-to-day exercise. They're not relying on anybody else. That information is in their hands. It can be improved, of course, with interaction with the practitioners, but they become a part of the health journey, less reliant on the system. We've also partnered with the Buffalo Center for Health Equity to move this solution forward, because as we all understand, people on Medicaid tend to wait the last moment and end up in urgent or emergency care units that are prohibitively expensive and really not delivering any sort of affordable care whatsoever. And in fact, the cost of treating these individuals is much higher than it should be. The other thing that I'll add around the trust is that the beauty of the technology is that you see it happening. You get to follow as you change your action plan or any intervention, whether it's working or it's not. You can see if it's not working, you can make adjustments. And so you start to trust the physical aspects of your health beyond just what is being shared with you through how you're feeling, et cetera. The other thing that I'll share is that we continue to do expanding on studies with practitioners. We recently worked on some cancer therapies where we're able to demonstrate that immunoreactive adverse events associated with checkpoint inhibitors could be predicted in individuals that went on to develop them and others that didn't. And we can actually see how the cancer therapies were being beneficial to those patients. And so this idea of demonstrating that the intervention is working has huge value, especially as we move more and more into value-based care method. And then the other thing I'll add is that by looking at each individual's, we can roll that data up and understand where a population is and give that visibility to payers so they understand where those big expenses in their healthcare dollars are going to come, so that they can apply resources accurately rather than guessing on claims data. They can see exactly where their populations are trending, whether it be in a employer base or Medicare base. And then the last thing I'll add is that we're also doing a lot of work in Alzheimer's disease, and we've partnered with a group out of Florida where we're starting to work more in this guide program. So how do we provide that evidence-based support in the guide program that allows the patients to see, what is the best care path for them? We've been able to endotype and stratify Alzheimer's disease into 3 different categories so that we can really carefully design the care path that's going to be appropriate for them. And then by sharing this with Medicare as we go forward, we'll be able to demonstrate the return on the investment, and this will be supported going forward. So our goal is to make this as affordable and accessible to all people. And we all know that predictive care or preventive care is going to be a lot more affordable than reactive care.
Thank you. Powell?
Yep. So in terms of our central tenets, and I'll start with the equity piece, is really Paul Farmer said that the idea that some lives matter less is kind of the root of all that's wrong with the world, and so we really take that very seriously as we build that. Many of us are practicing clinicians, and we've identified that the older age population is certainly a population that's challenged with equity issues as a whole, challenged with socio-financial issues as a whole. But even within that community, there are clearly the haves and the have-nots, and sort of going in without the blinders is really important. We understand, a couple of the key pieces around data. So not all, senior aged individuals are created equal, and therefore you need to create, sort of a data model and an access that's individualized for populations. Dr. Klasko, you mentioned, Miami. Versus Appalachia. I mean, even within cities, there's issues. My family emigrated to Newark, New Jersey. They lived in an area where life expectancy was 86 years of age, and across the other side of the tracks, it was 69 years of age, right? And so we've incorporated, publicly and individually incorporated data sets that really look at things like urbanizations, measures of care access to primary and specialty care, mental health access, social vices, et cetera, that ultimately are going to drive care outcomes in an individualized fashion for people, even within a given geographic cohort or even a population cohort. And I think when you start to drive access needs to be, sort of individualized as well. So making sure that care managers and clinicians are really double clicking on people that may not hit their radar is really important in terms of delivering contextually and culturally competent care. I think there's a thing around, social marginalization, that there's some commonly sort of or conventionally held wisdom about who in population is, socially marginalized. So I practice care in a primarily Caucasian community. My family is originally from Portugal. I could tell you that prior to me, and there's not a lot of Portuguese-speaking docs out there, these people received care in English and in Spanish, or they didn't receive care at all. So my first visits with many people were the dumping down of a lot of different things that they wish they told a lot of different doctors beforehand. We understand that, and we're really looking for sort of those, outliers when it comes to social access as well. And it doesn't only pertain to race, ethnicity, but just even social isolation, belonging. All of those things are important ways in which we build our models. I think the last thing from an equity standpoint that I want to talk about is data quality. We talk about the COVID pandemic and the fact that there was a disproportionate amount of Black and brown Americans that were affected by the COVID pandemic. Well, we don't do a great job of data capture of race and ethnicity, right? And so I think we probably even underestimated the impact on populations because of the fact that even our demographic data capture isn't great. And so we have to understand that that's a blind spot and we have to address it. I could tell you in some of the models that we've built and some of the issues have been addressed already, things like Alzheimer's biomarkers, you can't use, standard population norms for all populations, right? Because some biomarker levels are lower in individuals to begin with, and sort of using, sort of an average across population and not necessarily tying it into the way a patient phenotypically presents may not be appropriate. And then if you look at data, clinical data at face value, you'll see that Blacks, Latinos, and non-English speakers probably have lower incidence if you're just looking at the data at face value of things like frailty. The reality is that many of these people don't even present to healthcare centers because of trust in primary care, or they tend to receive reactive care and tend to go into more urgent care environments to receive their care. And so we really need to be conscious of the veracity. So one of the V's of big data, we need to be conscious of the veracity of data. And so we use a federated learning approach and really question model inputs, question model outputs to make sure that every population and every individual is right-sized and addressed. All of our, in terms of a trust standpoint, we're clinical guideline premised. We're big on making sure that there's reproducibility and that there's evidence basis in anything that comes out as an output, that it's not a black box, and that there's explainability. I think clinicians are comfortable with probabilism. We all sort of differential diagnose in a very Bayesian manner, right? And so getting them comfortable with probabilism that's not their own is, I think, an important piece. And so I think that explainability and that transparency is hugely important.
Great.
And then to kind of close on cost and sort of who pays for that, I think the value-based care arrangements are really important. We've spent too much time in our healthcare system rewarding operational metrics as proxies for outcomes. Everything that we're focused on is outcomes based, right? We want to see people get better. We want to see people have increased lifespan, but we also want to see people have increased health span, and that's tantamount, and that is accomplished by the true intent of what value-based care was supposed to set out to accomplish.
Thank you so much. So last question is going to be 3 to 5 words. We're going to get through this in 3 minutes, and basically it's hit me coming over from the traditional healthcare ecosystem to General Catalyst that the humans that are involved in your team are incredibly important. And all of you have curated, because it's all your money, who you have on your team. So in 3 to 5 words, if you could just say, what defines the culture of your team that really makes it unique, that will get somebody to want to invest in you. Vinay, I'm sorry, I missed you. Let me get you to do your 3-part question. I apologize.
All right, I'll keep it to the 90 seconds. So hopefully we can do the fun exercise as well. Yeah. So with Manifold, I think there's a couple of ways we think about equity. One is actually supporting the researchers that are doing the equity, that are doing work with a lot of different populations, especially where there's a lot of health disparity. So all of the fantastic technologies, we've heard about here today, for example, and especially Paolo with your examples, they all need to be tested. You need to bring together clinical data, genomic data, biomarkers, geospatial, environmental, wearable data. And these are the things that are hard to do, are expensive to do. And so supporting researchers and being able to do this with health disparities, related to health disparities, has been an important part of our work. We just announced our partnership with Dr. Melissa Davis at Morehouse School of Medicine, where she's sort of really pioneering these types of data being brought together, and in fact finding the biological basis of some of the differences in disease, in addition to some of the structural and systemic aspects as well. So we're really fortunate to be able to partner with folks like that. I think the second part of equity is really the researchers themselves. The kind of expense that's historically been required to do this kind of leading edge research that brings together multimodal data, it's really not available to institutions that are not super well resourced. If you're an early investigator in your career, you just cannot do this kind of work. And what our platform is doing is really making it possible for a lot more people to do that. So, in many ways, like who is doing the research matters just as much as who is being researched. And I think we can really make a dent in that. Maybe just I'll mention briefly on trust. We think a lot about why researchers should trust the data, and actually thinking about how to make that findable, accessible, analyzable for them. So really building trust for the researchers in the data so that then they can trust the output. And then finally, who pays has been an interesting conversation for us, because one of that we traditionally sell to health systems, cancer centers, organizations like that. And one of their first concerns is, are you taking our data and selling it to pharma? And we made a very conscious choice that our fiduciary is the health system and the researcher. And so you know, we do have made that choice, but again, we make the platform pretty accessible for all kinds of researchers. So that's hopefully 90 or so seconds.
That's great. So 3 to 5 words, guys, that you know, how would you uniquely describe your team and its culture? John, let's start with you.
Having good humans on the team is paramount.
Perfect. Paolo.
Hire for attitude, have a mission, and empower.
Fantastic. Scott.
Diverse, passionate, and mission driven because it's personal.
It is personal. Thanks, Rob.
Purpose driven, radical collaboration, and value based.
Thank you, Ron.
Try to make the world a better place for the elderly.
Thank you, Seth.
Experienced and extremely collaborative and flexible.
Great. Isan.
Believe that every eye exam could save a life.
Beautiful. Kelvin.
Ethical, resilient, and empathetic.
Love it. Vinay, I want to make sure I don't miss you.
Thanks. Impact, collaboration, innovation, and get stuff done.
Great. Ryan.
Diverse, purposeful, respectful, empathic, and interdependent.
Beautiful. Mary.
Growth mindset, human-centered, and change makers.
And then finally, Asaf.
A unique combination between creativity and empathy to help us to drive for innovation and to kind of create a new category to help older adults.
Beautiful. Well, before I turn it over to Andy to say a few concluding words, I'm already feeling better about being 75. So thank you. And it's interesting because if anybody tells you, you know, that older folks aren't going to use the technology, one of the interesting statistics that I saw is one of the top demographics buying Apple Vision Pros for $3,300 is people my age. And you know that because as soon as you go on the website, it asks you what your prescription is because they have a partnership with Zeiss. So, you know, they're not catering to 26-year-olds. So I think what you folks talked about with trust, accessibility, et cetera, is really true. I just want to remind everybody before I turn it over to Andy about the all-day winners celebration on October 21st. So from 1 to 2:15, we'll have the Rising Stars Announced Awards on the pavilion stage from 5 to 6. Best in Class grand finale with disco stage, and then from 6 to 9:30. As always, the after party is the best, and we'll have the award winner celebration at Milo's and Milo's restaurant, which is a really cool restaurant at the hotel. So what do you think, Andy? Feel good?
Yeah, this is great. So first of all, thank you, Stephen, for moderating this discussion and keeping everyone, you know, thinking and moving in this conversation. Congratulations to all of you. You know, I spend most of my days trying to find people just like you. And so it's a pleasure when I get to sit in a room in a virtual room and get to hear such diverse and you know, solutions that are really making impact. So again, congratulations. I look forward to meeting each of you at Health and good luck as you move forward in your business.
Thank you all. Onwards to Las Vegas. Thank you.